Amalia is our patient today. She is 54 years old, and she is interested in a very popular procedure, hand rejuvenation. I find that many patients have become interested in this procedure. They come to see me for facial rejuvenation and for other procedures, and then they say, "Doctor, what about my hands?" And so today we're going to demonstrate a very straightforward procedure, and we'll use a state-of-the-art filler, Radiesse, calcium hydroxyapatite. Typically, when we're evaluating a patient for aging hands, we want to look for two things. And the first thing we look for are aging spots, and these are usually discolorations that we can see on the dorsal surface of the hands. And Amalia shows some of the early changes of aging. We do have some hyperpigmentation in some areas, but this is not the predominant feature that we see. For these types of things, we usually use a pulse dye laser, and that can take the color out. The most important thing that we look for in all patients is loss of volume. Usually patients will tell me that they don't like the vein show, they don't like to see the tendons and the fine anatomy of the hands, and they want fuller hands that suggest a more youthful appearance. So today what we're going to do is use Radiesse and a nice carrier, and we'll use that to add some volume to her hands. Now what I've already done, Amalia, is I've just added a little bit of numbing medication. And we're just mixing that with a little bit of numbing medication so you can have a nice, comfortable treatment. So what we'll start off by doing is adding a little bit of the product in just a little volume, a bolus. And I'm going to tint the skin just a little bit, and we'll introduce the needle like so. 1, 2, 3. Here's a beauty ouch. Beautiful. And then we're just going to very, very gently add a little bit of the product. And you can see the product being added in the subcutaneous space. And can you feel that, Amalia?
No, not at all.
Good. And as you see, this is very well tolerated. And patients are quite surprised that there's really very little pain associated with the procedure. Now, once we've added the product, we now want to mold it. And so we just begin to mold the product into place. Patients want to come and they want something quick and they want to see it. And that's precisely what this product allows patients to do. How do you feel?
Okay.
How was that? Did you feel it at all?
Not at all.
Great. This product creates a natural scaffolding within the soft tissues and allows Amalia's own tissues to grow and to sustain the volume. And you can even see it as I'm moving it throughout. Soft tissues here. Do you feel anything at all? Wonderful.
Little pressure.
Right.
From your hand.
Ah. Okay, let's flatten you back out. Very, very good. And you see, with essentially no pain, we've got a nice correction. And you know, it's normal to see some evidence of the normal hand anatomy, but I'm very happy. It's a very natural look. She may have a little bit of redness, maybe some swelling. After the procedure, we like to have Amalia avoid things that can exacerbate bruising, which would be aspirin, Motrin, Aleve, and so forth. We'll probably see her back in a week, and in a week's time, we'll take a look and see if she's happy, if there are other areas that we need to correct. If so, we can add a little touch-up. And then I usually have her come back in about 3 months or so. And at 3 months, again, if we need to do a small touch-up, we'll do so. And that really, I've found, helps to extend the longevity of the product till about 1.5 years or so, which is what we're aiming to do. We've just treated Amalia's right hand, and we've not treated the contralateral left side. And on the left side, as we saw on the untreated right side, we still see more veiny prominence. There's evidence of tendons and so forth. The skin's a little wrinkled and crepey. And so I hope that demonstrates very nicely the contrast between an untreated left hand with some of the architecture quite visible, and a little bit more soft tissue cover, if you will, over the treated right hand.